Brenda. I'm Sarah, I'm a nurse practitioner student. So I understand you're coming in today with some left knee pain due to an injury that happened about 1 hour ago, and you noticed some fluid buildup. And you've had a similar injury to this, and you've also had some fluid buildup with aspiration done.
Yeah.
How would you describe the pain right now?
It feels like a lot of pressure.
And is it constant pressure? Where exactly are you noticing the swelling?
On the outside over here.
Okay. Have you done any ice or heat or medication since then?
No.
How would you rate your pain on a scale of 1 to 10?
4.
4 out of 10? Well, your x-ray showed that there was no fractures, so I would also recommend an aspiration today. How that's going to work out, I'm recommending it because we want to make sure that we're relieving that pressure in the joint so there doesn't cause further damage of your joint, and then to also help with some of that pressure and pain that you're feeling. So how this is going to work, we're going to go ahead and clean up your knee with some antiseptic solution, some betadine. We're going to go ahead and insert a needle kind of about right here. It's going to relieve some of the pressure by pulling the fluid out of the joint. After that, I'm going to be injecting a steroid injection right into the knee. It's going to help relieve some of the pain and inflammation that might happen after the procedure. You might expect to feel some discomfort and pain during the procedure. After the procedure, you'll also might notice some bleeding, swelling, drainage. That's normal. The drainage is normal, and it's expected as well. And the pain you should expect to be about 48 hours before it starts feeling a little bit better. Any allergies?
No.
Any bleeding disorders?
No.
Perfect. I'm going to have you go ahead and lay down. We'll start the exam. Just looking at Brenda's legs right now, they look even and symmetrical, normal muscle tone. Skin is warm to touch, dry and intact. I'm going to go ahead and palpate starting from the quadriceps. Any pain over here?
No.
Just going to palpate the patellar ligament here. Any pain in the tibia?
No.
Good. I'm going to go ahead and palpate the medial aspect of the patella. Let me know if you feel any pain, okay?
Okay.
The lateral aspect of the patella. Go ahead and do the rest of the exam just on one leg for time's sake. I'm going to go ahead and feel the condyles of the tibia. The lateral and medial aspects of the knee. And check the pulses, 2 plus 5. Laterally, gonna go ahead and check range of motion. Go ahead and bend your knee all the way up. Perfect. Go ahead and extend. I'm gonna go ahead and bend it for you. Any pain?
No.
Good. And go ahead and just lift for any hyperextension of the knee, which I don't see. Good. I'm gonna go ahead and start the exams. We're gonna start with the posterior and anterior drawer test, checking for any laxity of the ACL or PCL. There is no laxity. We could do the same with the Lockmans for ACL laxity. And there's none noted. Gonna go ahead and check the MCL and LCL. And we could do this with the varus and valgus stress test. I'm gonna go ahead and bend just a little bit. Any pain?
No.
Okay. Pain?
No.
All right, last one we're gonna do is the McMurray's. I'm gonna have you bend here. Good. We're checking for any meniscal injury. Feeling for any clicking. Any pain when I did that?
No.
Good. And gonna check for any blood first. There's not extensive fluid buildup. There is a little bit just on the lateral aspect right here. Alrighty. So we'll go ahead and measure out the landmarks. So we're going to go 1 centimeter up from the lateral and superior aspect of the patella. I'm going to go ahead and mark it. I'm going to go ahead and clean it with some betadine. Then we're going to go ahead and inject at a 45-degree angle. You'll feel a little bit of pain and pressure, okay? I'm going to go ahead and aspirate to make sure we're not getting any blood. And we're going to go ahead and pull back and allow the fluid to aspirate. Good. We're going to switch this out with the corticosteroid. We're going to do a 1-to-1 Kenalog and lidocaine. We're going to aspirate to make sure we're not in a vein. We're going to go ahead and inject. I'm gonna go ahead and cover with a 2x2. Apply some pressure. So for the next 2 days, I want you to keep it clean and dry. I'm going to expect you to have some pain for the next 48 hours. So you can use 600 milligrams of ibuprofen every 6 to 8 hours as needed for pain. A little drainage is expected, so don't be alarmed. I want you to call me though if you are noticing any excessive drainage, bleeding, pain, really bad bruising or numbness or tingling down into the leg here, okay?
Okay.
Any questions?
No.
Perfect. We're all done.